Good morning, everybody, and thank you for joining us for today's presentation. My name is Jennifer Rakowski, and I'm with the YMCA of Metro Atlanta. I'm the Director of Program Management and have worked very closely with the Parkinson's Foundation over the course of the last 5 or 6 years. We have implemented Parkinson's-specific programs at all of our YMCA Atlanta locations, which is 18 across the Metro Atlanta area. We started with basic movement classes and then transitioned into group cycling classes, and most recently Parkinson's boxing classes, which have been wildly successful. And while we are currently not offering any Parkinson's specific classes, we are anxious for the day when we can restart those classes and see everybody back in our facilities. But in the meantime, we are working on some videos, which we will be sharing with our YMCA members very soon. And definitely look forward to seeing everybody's faces and getting everybody moving again. But moving on to today's topic, I am super excited to introduce Martha Ann Tudor, who's joining us from the Augusta University Movement Disorder Program. Martha is a nationally certified mental health counselor who specializes in trauma and loss and providing insight and direction for turning unwanted change into opportunity and growth, which I know we can all relate to during this time. So without further ado, Martha, I'm turning it over to you. Take us away.
Okay. Thank you, everyone, and thank you, Jennifer. As we see, you know, we're a team dealing with Parkinson's, and patients and the rest of us serving this population are so indebted to programs like the Y for your variety of services and programs that you're making that really do make all the difference in the quality of health for those living with Parkinson's. And so we wanted to start today to just sort of give a brief overview before we get into the issues of depression and anxiety. Because depression and anxiety, patients will say they impact the quality of their lives more than even the physical symptoms, the motor symptoms of this degenerative disease. We know that Parkinson's is the second most common degenerative disease next to Alzheimer's. There are 10 million people in the world living with Parkinson's, 1 million in this country, the United States. So we've established that depression, anxiety, irritability, mood issues, apathy, often go hand in hand with a Parkinson's diagnosis. But what some people may not know is that there are a lot of other non-motor symptoms that can signal perhaps Parkinson's. And those include things like vision problems, like increase of dandruff, like a loss of smell. And of course, these can be associated with other diseases and disorders as well. Sometimes Parkinson's can be hard to diagnose. It's a complex thing. There is no simple test for Parkinson's. But these are nice to be familiar with these symptoms so that one can pick up on maybe what really is a lesser known symptom of this disease. So we can go on to the next slide, Annie. And we know that at least 50% of those diagnosed with Parkinson's will experience some form of depression. This includes patients who had struggles with depression before they were diagnosed and those who didn't. And up to 40% will report experiences with anxiety or some type of anxiety disorder. And this, by the way, was before COVID. So what we know now is that we have Parkinson's patients reporting even more being affected by depression and anxiety, and we're going to talk about that in just a moment. And Annie, I think the next slide takes us to this Parkinson's Outcome Project. You may be familiar with this already because it covers so many different topics. This is a longitudinal study that has been going on for over a decade with over 13,000 participants from around the world. There are lots of findings. Today we're looking at what it's telling us, a little bit of what this study's results are telling us about depression and anxiety. These results that you see on your screen, this snap chart right there, was accurate as of May 2020, so it's very current information. And we know that depression and anxiety are the #1 factors impacting the overall health of people with Parkinson's. And this is going to be even more so than, say, the motor symptoms that we think of when we think of Parkinson's, like tremors and dyskinesia and freezing. And one of the exciting things about depression and anxiety being so impactful for people living with Parkinson's is that it's something that we can do a lot about. We cannot offer cures for Parkinson's, but we can offer interventions and experience and skills that do make a huge impact in the quality of life, not only for the patient, but for the care partner and for anybody in the patient's family and life. All right, we'll go to the next one, Annie. So we just mentioned already, you know, that COVID is causing us, all of us in the United States, more problems with our mental health. We mental health providers have not even scratched the surface of all of the issues that are going to emerge. I think the latest study I was looking at yesterday was talking about the increase in PTSD of people who have had COVID, gone in the hospital, been on a ventilator, and survived. But the experience of the ventilator has left them with trauma, a good many of them. So we just don't even know yet all the layers of the issues that are going to come to surface, but we do know that they're there. And some things we're already seeing is the impact, especially among people with chronic disease and especially among people who are older. So a lot of Parkinson's patients fall into both of those categories. Because when you know that there is a pandemic, a virus, potentially fatal, for which there is no known cure or vaccine at this time, and you have Parkinson's, a chronic illness, Parkinson's for today, talking about today, you know you're more vulnerable for risk factors. You're more at risk for complications if you do get COVID. And so naturally, that's going to cause stress, the worry about getting sick, the worry about what happens if I do get sick, the fear of being exposed, not getting enough exercise. Jennifer was telling us at the beginning of this how the programs at the Y have been suspended because they're taking the health seriously. But where does that leave you if you were depending on that? And here we are saying, get up and move, but your class has been suspended. Social isolation, you know, it may not be safe to go to your faith service every week. It may not be safe to go to your support group, to your gym. People worry about going to the doctor's office, to clinic. So that can be very isolating. DBS, for those of you who've had deep brain stimulation, I mean, what if my battery dies during this time and it's not safe to go back into the hospital and get that taken care of? Missing friends and family members. I know with the Parkinson's individuals who I have the honor of working with every day, I hear this a lot, you know, out of protection and concern and recognition that they are at high risk. Family who might have come and visited during the summer, canceling trips. You may not feel safe going to that granddaughter's wedding, going to see the new baby that's been born. So I know that has hit hard, come to hit hard in the lives of a lot of our patients. Okay, next slide. And then this is just simply talking about just verifying again what we were just saying as far as that mental health is struggling among all of us. And this is just a take of the entire United States, people of all ages, people with chronic disease, and not everyone, 40%, which is a pretty whopping percent of people as late as this past June reporting that they were struggling with mental health or substance abuse. Okay, next slide, please. So we talked about some common non-motor symptoms of PD, and that the anxiety and depression are right at the top. We're going to talk about these separately in a minute, but for right now, there's some things where they kind of, there's some overlap with anxiety and depression. And both of these are normal sometimes. There's nothing wrong if you have, sometimes you're worried about things. If you're in a situation of uncertainty or a danger, it's normal to be worried. If you have a letdown or a disappointment, it's completely normal to feel sad. So when is it a problem? And one thing that we know is it's more about how long it endures and the degree to which these things are happening. If they don't let up, if they just come to stay, they persist. You're not just sad about this, but this overriding sadness, perpetual worry, ruminating all the time about things. Sort of oversimplified, but it would be if your worry is sort of out of proportion maybe to the risk that's in front of you. And we know that these are not happening, and this is not because somebody is just choosing to not have a good attitude, or they're just being lazy, or they're just being negative. You know what doesn't help somebody worry less? Being told you need to worry less. And you know what doesn't help somebody feel less sad? To say, well, you just need to cheer up. So these really have underpinnings in our biology. There are real reasons, especially in Parkinson's patients, there are changes in our brains that cause depression and anxiety. So it's real, it's valid, a person isn't making it up, and they can't just be instructed out of it, ordered to just get a grip. Anxiety and depression, while there are some differences, if we look at it this way, like how they're both caused by changes in our brain, chemistry in our brain, they're really sort of two sides of the same coin. And they can happen sequentially, meaning one can lead to the other. So for example, if you have anxiety about getting out and engaging with others in any way, even a safe way, then you're going to miss some positive interactions and experiences. And you're going to miss some positive interactions and experiences that could have brought you restoration or encouragement or uplifted you or helped give perspective. And then without that, the lack of encouragement and the lack of perspective and the lack of that connection, that can lead to being sad and depressed. So that what we mean by sequentially. One can actually lead to the other one. And simultaneously, you can certainly have both happen at one time. So next slide. And so for folks with PD, some things that we think that we have, if you think you might be suffering from anxiety or depression in a way that needs your doctor's attention, is to keep a journal. Like we said, this is not momentary. So a journal of about a month, maybe at least over 2 weeks, where you just sort of write down. It doesn't have to be anything formal. It doesn't have to be an Excel spreadsheet, but just something that's, what are my moods and feelings? What's happening with my medications? What am I on? Have I increased those, decreased those, changed those lately? And what are my motor symptoms happening? So this can be good information if you do feel like you need to show your movement disorder specialist or your physician's assistant, and they can help them draw some the best conclusions from that to get a good picture on what might help you the most. Also good to include in that journal would be what makes your symptoms worse. And what makes your symptoms better? What's helped in the past? I don't know, something as simple as I have a harder time going to sleep when I've just watched the news. That can be a typical thing. I feel better when I have moved my body more. Just things like that, nothing's too small to note on this. And tell those around you, someone you trust, how you're feeling. You're not meant to do this alone. It's why Jennifer was talking about it, the Parkinson's Foundation. I'm here, your movement disorder specialist. the boxing classes that Jennifer mentioned, your physical therapist. Everybody is here as a team to give you that holistic approach that the Parkinson's Foundation so endorses in addressing Parkinson's disease. And the support group, some of the support groups might not be meeting in person right now. There are different kinds of support groups, but being with other people, whatever it is in life, that are dealing with what you're dealing with, can be invaluable. People can share resources that helped them, maybe even share some things that didn't, so you don't waste your time with that. Things you might not know about otherwise. It's just, there's so many good reasons to be part of a support group. A lot of support groups have newsletters with lots of tips. So even if they aren't meeting in person, just getting that newsletter emailed to you or mailed in the mail can be a lot of good information. It reminds us we're not alone, and you're not alone. And that is important to remember. And then some support groups are meeting online. And some I know have gotten pretty creative with that as well. So look into that and see if there's not a way. And then be flexible, try new approaches, because a lot of what we did depend on before COVID has changed. I don't know anyone whose life hasn't been affected in some way by the COVID crisis. So it's just our normal way of going about life has changed on us. We've talked about some of the resources that we had, some of the activities just simply aren't possible anymore. So be flexible and try something new. All right, next slide. So about anxiety, I'm going to look at anxiety for just a minute, depression just a minute. Then we're going to talk about some things that you can do to take control back of your life, because I think that's the thing that we all need to remember and remind ourselves and encourage ourselves with is there's so much, the world would appear to be spinning out of control. Everything from the wildfires to the headlines, the politics, there's so much that's concerning in our world right now. And then with Parkinson's, all these limitations that have been put on us, the changes happening in our bodies that we cannot do anything about, it's easy to feel that you're not in control, but we need to remember that there's a lot you can control that literally can make enormous difference in your quality of life. So research shows us that 2 out of 5 people with Parkinson's diagnoses will experience some form of anxiety, as far as the generalized anxiety disorder, which is worrying about everything, anxiety attacks, social avoidance, and you can see how COVID would come along and exacerbate some of these issues. So social avoidance, one thing we try to deal with is encouraging to get out there. Don't worry about being embarrassed, or let's talk about that. It's very normal tendency with Parkinson's to want to avoid social interaction and stay home. That's something that we deal with before COVID. And now we're told, don't get within 6 feet of anybody. Don't get in that crowd. Don't go inside that building. And then obsessive compulsive disorder, which one of the most common manifestations is excessive hand washing. And now we're told wash your hands all the time. So it's easy to see how the very safety guidelines that we're all being told to follow are actually coming along and sort of worsening maybe some anxiety that we had already maybe had success in dealing with, or maybe experiencing for the first time. Some mental markers of anxiety, again, excessive fear and worry. The key word there is excessive. If you find yourself ruminating most of the day, if you get in sort of a thought loop and you can't get out of it, worrying about things out of proportion, worrying about things that may not ever happen. And this would also go hand in hand with these uncontrollable thoughts, like not being able to stop yourself when you try. And then you can see the ritualistic behaviors, problems, sleeping, dizziness. So these are some common symptoms that might say to you, I think maybe I'm having a problem with anxiety. Next slide, please. And so the SSRIs and the benzodiazepines are medications that have had a lot of success in treating anxiety, particularly in Parkinson's patients. But I didn't go to medical school, and I can't comment on the medicines except to let you know that sometimes those are good options. There's not for everybody, but sometimes. And it's worth asking your movement disorder specialist or physician's assistant or movement specialist nurse if this might be something that would help you. Whether or not you take medicines, there are other things that also can help, either instead of or on top of. Psychotherapy. And this is counseling that we know can really help, to have a safe place to say, this is how I feel, and to talk about those thoughts and maybe learn some techniques like deep breathing or mindfulness that you can do anywhere. They're easy, they're quick, nobody will even know you're doing it. And to help calm yourself down, you know, when you find yourself maybe starting to have an anxiety attack or feeling like you are kind of losing control, to remind yourself, you know what, you can self-manage that. You really are in control. Non-conventional therapies, we know the more the research comes in, the more we know these are very, very successful. So relaxation techniques like the mindfulness, the Parkinson.org site, which is the site of the Parkinson Foundation, has a treasure trove of information if you're not already familiar. They have Mindfulness Mondays, but they also have lots of information on handling mental health issues that come along, podcasts, past broadcasts, past programs that have been archived, ongoing and future ones that you really want to avail yourself of. Everything is free. Everything is available to you. Massage therapy, acupuncture, aromatherapy, the meditation we talked about. There are also, you know, a lot of free apps for meditation and anxiety, calm apps that you can Google and look at. Some you pay for, but there are a lot that are really good that are free that you can put on your phone. Music therapy. There's just something about having some nice music even in your home that sets a nice tone. And of course, moving your body. And I'm going to go on to depression for a moment because some of these overlap. We'll talk about them at the same time as far as like the exercise. So can we go to the next slide, Annie? Annie, can we go to the next slide? Okay, there we go. So we talked about depression and it's different than sadness, right? Everybody gets sad sometimes. Sadness comes and goes. Depression kind of comes to stay if it's not treated, persistent. It needs to last for at least 2 weeks without lifting for this to be clinical. And we know again that there's a real biological basis for this. This isn't somebody in somebody's head. This isn't somebody just woke up on the wrong side of the bed. This is based in changes that are happening in their brain. Next slide, please. And we talked about this a little bit. There are a lot of symptoms of depression. Some of the mental markers that you will see will be the same as the ones for anxiety, as far as changes in sleep or appetite, the fatigue, and difficulty concentrating. Depression also a lot of times comes with feelings of worthlessness and hopelessness. Nothing good is going to happen. Nothing good is going to happen to me for the rest of my life. Because of that, I just don't even really feel like getting up and bothering with the day. I feel worthless. And then, of course, thoughts of harming yourself or not wanting to be alive anymore, suicidal thoughts. So next slide, please. And, you know, one reason we talk about this today, too, is depression and anxiety can both be overlooked and undertreated. When someone has a chronic illness, especially, you know, well, they've got this illness, of course they're down, or they're just going to be down. But that's not the truth. I mean, there are a lot of people I know living very high quality lives, amazing lives with Parkinson's, where it's all about optimism, openness, enthusiasm, encouragement. So when we talk about anxiety and depression, again, as we were saying a minute ago, we recommend holistic approaches to both, the Parkinson's Foundation. And so we see some of these same things on here, right? The exercise, the counseling, maybe medication again for depression. And again, talk to your doctor about that. You know, say, hey, this has been going on. It's been going on for a month. I kept a little chart I wanted to show you, see if anything, you see any patterns there. Do you think that there's one of the medicines that would help me? But regardless of that, we can wholeheartedly endorse to you other things that will additionally improve your quality of life. And let's go to the next one, please. And so that's what we're all led us up to this conversation right now, which is about taking back control. So, okay, you know, I've got Parkinson's, I have anxiety and depression. I realize now that I don't just need to get a hold of myself, that there's a real reason for this. It's not just something that I'm choosing to feel like. So what can I do about that? And this is a quick list. There are more, but I was going to go over these things with you today about that we know research shows us can really make a difference and that are completely within your control to do. Routines and schedules. We all do better with a routine and a schedule. And maybe your schedule was to get up and start the day with going to an exercise class that's now been suspended for the time being. Maybe your schedule was to go to a support group every Tuesday afternoon, and that has been now suspended. So you can make your own. I mean, you know, if what you had isn't working anymore, then improvise and think of an alternative. So, I mean, maybe you want to get up now and you're going to do an online exercise class, you know, in the morning. We know research shows us that intense exercise in the morning for Parkinson's patients lowers the stress hormones for the rest of the day. So, you know, make your own schedule and normalize things. You know, I have worked with some patients who felt like, is there something wrong with our marriage? Is there something wrong with our relationship? Because we're having a lot more frustrations now, irritations. But when we look at since lockdown, you're together a lot more. And it's just normal, whether that's with a spouse, with a child, a grown child, extended family, a roommate. You're just going to, the more time you're together, it's just going to be normal that there's going to be some conflict. So it can be, you can normalize it. You know, boy, we're spending a lot more time together. Include some humor. That is an extremely protective factor. Humor. Try to laugh about it a little bit. It doesn't necessarily mean that there's something wrong with your relationship, because you're not just, you know, all flowers and butterflies 24 hours a day. And then we talk about, so plan your time, and in whatever your circumstance is, you may all be in the same house. But to try to take control again and have some order in your day. So something along like, you know, would you like tonight at 7 o'clock to play a board game with me? Let's look forward to, let's make tacos for dinner. Let's order out tacos if we don't want to make them. Would you like to watch a movie with me today at 4 o'clock? Just things that you can have to look forward to. One couple I work with, where one of the partners has Parkinson's and the other is the full-time care partner, they told me that what they have been doing since lockdown is having a slow dance in the kitchen every day, you know, before their meal. And it's just something that they look forward to. So these little things to anticipate are very powerful and very protective. You might need some time apart. So even if you're in the same house, you might say, I'm going to go in here to the other room and read a book or do whatever. You might be able to go outside or just whatever your current living situation is. But you know, it's okay to say, I'm going to have some time apart and move that body. It's just so important. And I know Jennifer mentioned all kind of great classes for Parkinson's patients, an array that she offers, that they offer at the Y. And right now, most of those sort of in-facility classes are suspended due to legitimate health concerns, but there are so many available online. We know that yoga and Tai Chi are especially good for balance and stability in Parkinson's patients. We know that boxing and dancing classes for Parkinson's patients are excellent for agility and flexibility. And these are all topics where you can find multiple offerings for free online. So that's really great to suggest that. But even if you're not up to that, just move. I mean, the thing you want to avoid is sitting for too still too long at a time. So even if standing up, you know, just standing up for a little bit, sitting back down, going in the kitchen and making a cup of tea, going from your chair in the living room to the veranda where you can be outside. Maybe it's a chair exercise, but whatever that is for you, wherever you are, wherever stage you're in or living situation or your mobility issues are, move, just move. If in doubt, move. And you just, like we said, you want to avoid sitting still for too long at a time. Getting outside, I just mentioned walking outside for a minute or sitting outside for a minute. Again, the research is just coming in, all of it more and more, the benefits to being outside. There's something about the color green even that we know is very restorative and brings peace and calm. Feeling the breeze on your face and looking at the sky and hearing the birds and seeing or hearing water. These are all things that help center us into the here and now and help us not worry about what might come down the road. So being outside is extremely healing and brings peace deeply into our hearts and souls. Staying connected is something that can also be to take back control. And you may have to have a little more initiative to do this, especially if you were someone that, you know, had people reaching out to you, or, you know, you got that connection, say, by going to your weekly religious service or seeing people at support group or seeing people at the gym, and now you're not going to those places. So you may have to be a little more proactive than you usually are about staying connected. But just like the fact that we're here today talking in this format, that's, you know, we're staying connected. Well, you can do that with your loved ones, right? It's a great way to say, keep in touch with grandchildren or children or neighbors or siblings or friends or entire groups, like we mentioned, support groups being online now. So these are ways to help stay connected, where you can actually see people's faces or talk on the phone. Some neighborhoods, you know, have people who have reached out, or churches or other faith groups have had people reach out and say, if you would like a call every day, please let me know. Or if you would like a couple of calls a week, would you let us know? We would like to put you on our list and reach out to you. And you may have to say, yeah, I'd like to be on that list. And you know, ask for help, stay connected, and maybe be a little forward with that, forthcoming yourself. Help others. So we all know when you help another person, it helps you get your mind off your own problems. And it's a very encouraging uplifting experience to help others. And if whatever you were involved in, if you were already involved in a movement, a mission, an effort that you believed in, chances are that they have still got a way that you can stay involved virtually. I think I don't know a movement right now that's not staying involved, staying connected, and so that people can still participate in what's going on. So, stay involved, help others, whatever that means. Be part of someone else's story, be part of someone else's journey, and maybe it doesn't have to be about Parkinson's. I know some groups have started Parkinson's buddies, where programs will, like our movement disorder program, we will pair you with someone else who has Parkinson's, of the same gender usually, and sometimes we take into consideration, your age and things like that. And it's like almost like a pen pal, and you can stay connected, and you can encourage each other. And when it's not COVID, meet for coffee and things like that. So, and that leads right into practice gratitude. So we know that practicing gratitude is very powerful, literally retrains the way you think. If you are always looking for what's going to go wrong, then you're always going to find it. But if you're always looking for what to be thankful for, you're always going to find that too. And you can just tell your partner, here's what I was thankful for today. You can keep a book and write down 3 things a day that you're thankful for. It can be simple things, the sound of the rain, that my hibiscus bloomed, a letter from a loved one, whatever it is for you that day. It doesn't have to be big, but whatever you're thankful for, and you will literally retrain your brain to be more grateful, because you will be noticing things that when you were thinking about what you wanted to complain about, you didn't notice, right? So you'll be noticing how many things there are. The more you look for things to be thankful for, the more you'll find them. And self-management. So this is interesting. We've been talking about that the whole time, right? Take back control, what you can do to really make a difference take responsibility for your own well-being. You can't help that you have Parkinson's, you can't help some of these other things, but you can take control and make sure that you get enough sleep. You can make sure that you're limiting yourself from the news. Don't scroll through. Limit yourself to maybe 2 times a day. I'm going to check in for no more than 30 minutes, and I'm not going to do it near bedtime. You can control eating healthy. I'm going to eat food that I know is good for me. I'm not going to eat the food that gave me trouble last time or, caused me problems. And then worry time is interesting. It's a technique that you might think is silly. It kind of sounds silly, but you know what, it works. And that's if you do find yourself stuck in these thought loops where you just can't quit worrying. It's perpetual worry. To the point that we talked about that is sort of out of proportion to maybe what the risk is or the concern is to schedule a time for yourself to say, okay, I'm going to worry at 10 o'clock for 10 minutes, 10 o'clock tomorrow, and I'm going to worry again at 4 o'clock tomorrow afternoon for 10 minutes. And you write down the stuff you want to worry about. And then if in a minute you think of something you're going to worry about, so I'm not going to worry right now, I'm going to put it on my list. And when we know we're not going to forget about it, it's on my list, I'm not going to forget it, I'll be able to worry about it, I'm going to do it at this time tomorrow. It frees us up to live a little more fully in the between time. Give it a try. I know it sounds almost silly, but it really works. And then we talked about these apps, which there's so many apps available right now. And, calm apps, deep breathing apps, even practice gratitude apps, grounding apps, deep breathing meditation that we know can help us kind of break a cycle of worry, break a cycle of sadness, and help reframe the day for us. So these are just a few. I'm sure there are more. I'd love to hear what you have, what has worked for you. And I think that Annie is maybe going to tell us some questions now that have come, that maybe some people have sent in.
Thank you so much, Martha Ann.
Oh, you're welcome.
Well, this is a lot of really great information, and hearing you talk, I know that everybody's gonna hopefully take bits and pieces away today, maybe not try everything all at once, but pick up on some new techniques here and there. So we do have a few questions, some that came in during as people were registering for the program today, and then some that have come in via the chat or the Q&A icon. So I guess the first question I'm going to ask you is, what should I look for in a therapist or counselor for my dad? I know many do not have a background in aging or geriatrics, or may not understand how Parkinson's can impact a person. So I want to be sure they are the right fit.
Right. Well, that's a great question, because there are a lot of therapists out there, and that it can be, you know, and when you need help, a lot of times you're not wanting to spend a lot of time trying different people out. So it's really nice to have a way of finding somebody who's a good fit. And so, again, I guess, first of all, one thing that comes to mind would be those support groups we talked about, because word of mouth can be great. You know, that's another way that being connected can be full of resources. And that's a resource. You know, this person helped me, and if they helped this person with Parkinson's, they're probably going to, you know, have a really good chance of being a help for you as well. Even though somebody can be a qualified, licensed, and excellent counselor, they may not be a fit. So there just always is that element also. There's a site, Psychology Today, online, that's an excellent resource too. I always recommend. And you can go on there, and so counselors put themselves on there, so it means they're accepting new patients, new clients, but you can sort through according to what sort of insurance they take, or if they do a sliding scale, or if they're cash pay, which is often a first question for folks. That's a first filter, wanting someone that takes their insurance, or, you know, takes Medicare, whatever their situation is. And usually these folks also, you can see their location, and then also they will self-list what their areas of specialty are. So first of all, I would go maybe to other Parkinson's patients, maybe your local support group, because they're going to probably be familiar. And then I would go maybe to a site like Psychology Today, where you can sort of filter through and start saying, well, this is somebody who's, you know, you can put in all of your filters and say, here's some counselors here that really meet my criteria. Some people want a faith-based counselor, some people particularly don't. Some, you said someone's father, he may feel like, you know, he has a feeling about, he want the age or the gender of the person, and all of that's fair. It's all completely fine. It's individual, up to that individual's feeling, and somebody that's a fit.
That's great. And I guess just in terms of the different types of healthcare professionals, you know, you have psychiatrists, psychologists, mental health professionals, you know, counselors, therapists. What would you say would be the primary reason someone might want to seek out a psychiatrist versus, you know, let's say a therapist or a psychologist?
So not all, you know, not all are the same, but as a rule, so psychiatrists have been to medical school, and they are very skilled at the management of medicines, prescribing and management of medicines, and how these interact with other drugs. And for Parkinson's patients, very common and typical drugs that medications that Parkinson's patients are put on are particularly prone to interact in maybe negative ways with some psychiatric medicines. So it's always a great idea to have a psychiatrist at least part on your team, who can oversee that and make sure that if you are on any mood medicines or antidepressants or anxiety drugs, that they're not causing any problems when considering the Parkinson's meds. Some psychiatrists also do talk therapy. Many do not. And so it's, It's counselors, that can be a licensed professional counselor, licensed associate professional counselor, a licensed clinical social worker, a PhD, someone at the doctorate level. Any of those people would be certainly very skilled and able to provide. We know cognitive behavior therapy, also called CBT, that's particularly helpful with Parkinson's patients. It's also kind of known as talk therapy. So that's a sort of a standard in therapy as well. Most therapists are going to be skilled at CBT, but it's, we found it especially effective with Parkinson's patients. Some places even offer group therapies for Parkinson's patients, group CBT therapies, and I highly recommend those. It was developed out of Rutgers University, and we know that those are highly effective.
That's great. And I would imagine too, during COVID, a lot of these healthcare professionals are offering, telemedicine, maybe where you could even have your initial consult over the phone or.
Yes, absolutely. Thank you for saying that. Yes, so just like it may be harder to get to the clinic, to see the doctor, it can be harder to go back to the counselor or find one if you're thinking about in person. However, you're right. Telemental health is right in step with telehealth. And in fact, in my profession, the professional counselor, we all were required to, and when lockdown started, we all had to go back and get extra training in telemental health. So you do want someone who's had that training and that certification, but counseling lends itself particularly well to the tele setting. And, it's really nice too for Parkinson's patients, anyone with a movement disorder, for whom just getting there can be exhausting, and so the ease of that accessibility is really nice, and it's very, accessible, very amenable to the tele situation. So yeah, I totally recommend that, and I would think most counselors at this point would be offering that for obvious reasons. I've had numerous clients say, can we, please, can we still keep doing it this way even after the COVID restrictions have lifted, because of the things that we're talking about, just the ease of getting there.
Absolutely.
Yeah,
absolutely. Because you don't, transportation, some of those barriers shouldn't add more stress or angst to anybody's plate, especially not now. So
right.
I know we talked about this earlier, but I think just maybe to re-emphasize, how does somebody recognize the difference between depression and anxiety and just normal annoyances or normal frustrations or normal fears, and I think what you mentioned earlier was the time frame, right? If it's lingering or persistent, that's when you should probably talk to somebody. But what are the main differences you think between just kind of depression and anxiety? And are there different types of healthcare professionals that sort of treat one or the other? Or could you, is it sort of visit a counselor and they can deal with any issue that comes your way?
Right. Well, I would say to start first with your last comment, I do think a qualified professional, mental health professional, would be able to recognize what you need. They're not going to try to treat you or treat something that's out of their area of competence. So if, someone came in with an issue where I didn't feel competent, then I would be obligated professionally to refer them to somebody who would. So I think that, as far as you're talking about generalized anxiety, depression type issues, those are sort of, that's sort of the meat and potatoes. You're going to find most counselors familiar and experienced with those. They're so prevalent, such prevalent problems in our society. But as far as the differences, I will starting in by saying, if you have any question, ask a professional. This is not a time to be, poo-pooing it or dismissing it or telling yourself you're just making too much of it. So if you really have any concerns, it doesn't hurt. It's always good to ask a professional. Also, I do think that the endurance of the problem and the severity of the problems. So is this something that, you know, is a momentary irritation, right? You know, this person is just talking too much and I'm irritated and I want to snap at them, or, you know, are these things that are just because we've all been now forced to be on top of each other so much? Is it coming from that? Is this something that, you know, I'm worried because I'm awaiting this very kind of scary test result to come back, you know, or I'm sad because I just had a major disappointment in my life, or a heartbreak. Well, this is normal. I mean, we all have these. So this is an indication that you're completely normal and healthy. But is the worry and sadness pervasive, where maybe it's not just one thing? It's just sort of, I'm just always worried about something, or I'm just always sad for no particular reason. Can't see, and it persists for at least 2 weeks with nothing letting up. Is it crippling my ability to live my life? You know, is it getting in the way? Am I unable to sleep? Am I unable to eat? Am I sleeping too much? Am I eating too much? Am I unable to have any joy? Am I unable to laugh anymore? Am I having trouble concentrating all the time? Is it hard for me to focus? You know, there's a list of sort of mental markers or symptoms for both. But it would be a matter, I would say, to simply say the endurance, that, you know, the time it persists, and the severity.
Well, in this next question, so this person is asking about stress and how stress can affect Parkinson's symptoms.
Mm-hmm.
You know, I think especially now, I think it might be difficult to sort of distinguish between I'm stressed out and versus I'm really anxious, you know, right? Stress seems to kind of come and go. Anxiety seems to linger, like you said. So how does stress really affect someone with Parkinson's, and what would you say are some of the best treatments or coping methods for stress?
So yes, I do. It's a great question again. We do know, I mean, research shows us, the doctors can tell us, I mean, I'm sure the patients can tell us better than anyone, that stress does worsen the symptoms of Parkinson's. It can worsen tremors. It can decrease the effectiveness of medicine. It can increase freezing. It can impact brachydinesias. So we do know that it does impact Parkinson's. It impacts all of us, but for a Parkinson's patient, yes, their other motor symptoms can get noticeably worse. And what you can do about it would just simply be the same things that we have been talking about in this program. What you can do are the self-care, the self-management. You know, if you go to a professional and you're talking about stress and you're saying, you know, I'm having these problems, this professional is first going to start asking you about what's your sleep like, what are you eating like, you know, what is your day like, what else is going on in your life, are you getting outside, are you getting any exercise, do you ever deep breathe, and so these are things, the very things that we've been talking about today would be the ideal things to put into place and to check yourself. If you're doing those things and you're still having problems that, you know, are sort of besetting, then that would be another indication that, yes, I do need to talk to my medical doctor and see if they think that I need medication, or that maybe I need, you know, some mental health professional help. Because there's just so much that we can do to take control and self-manage that really make huge impact. Another thing I just want to say isn't exactly what you asked, Annie, but I did want to make sure I pointed it out. I think too realistic expectations. You know, sometimes we put the stress on ourselves, right? I've got all this time, and I guess you know, and look, I haven't accomplished anything. I should have been getting more stuff done. And we need to remember that we're all under so much stress. Our nervous systems can barely keep up with the latest news headline, if we want to just talk about COVID, which there's so much else out there to be stressed about too, but what's the latest health precaution? What's the size group it's okay to be in? Is this class happening? Is it not happening? Is it okay to go out to eat outside? And are those people far enough away from me? What if other people don't have on a mask? Am I going to catch this? Is the home health people, are the home health people going to be able to come in? Are they safe to come in? It's so many things to be stressed about that honestly, to get up and get through the day successfully, like we're talking about, is a lot. It's not a really great time, in my opinion, to be trying to tackle a new language or write that book or, add on that room to the back of the house. So to have some realistic expectations of ourselves and give ourselves a break, like with most things, time, the little patience, grace, and a sense of humor helps a lot. And we need to remember to treat ourselves with that patience, grace, and sense of humor. And for a word for the care partner too, I hear care partners talk about having an expectation that it's their job to keep the patient, the person with Parkinson's, happy all the time. It's their job to keep them engaged all the time, to make sure they don't, that every moment they're doing the next thing they can do. They don't have a down moment. They don't have a sadness. They don't have a worry. And that's not realistic. It's not realistic. So I think it's also the realistic expectations and to be easy on ourselves and others.
Absolutely. Well, thank you so much. And yeah, I'm speaking of stress, little one's banging on my door right now unexpectedly. So, but Martha Ann, this has been wonderful. The information's been so helpful, and we just so appreciate you taking the time today to address some of these questions. So I would love to keep going, but unfortunately we only have a few minutes left. So I'm going to go ahead and close us out just with just talking very briefly about a few of the resources the Parkinson's Foundation offers specifically.
Thank you for having me.
Second. All right, so hopefully, everybody here is somewhat familiar with not only the YMCA Metro Atlanta, but the Parkinson's Foundation. We are an organization that focuses on, helping people here and now. We really want to support patients and families through this journey and also invest in research toward a cure. So one of the ways that we can certainly help you as you're battling or dealing with the mental health journey is to provide you with free resources and a life-saving aware and care kit. That's definitely something that you should order, in the event that you are going to be out or traveling or, having an unexpected hospital stay. Our toll-free helpline, for those of you I know who have questions about where to find a mental health professional, our toll-free helpline is fantastic. 1-800-4PD-INFO is that number. So you can call them and they can provide you with referrals to mental health professionals as well as your movement disorder specialist, or I know the other resources Martha Ann mentioned. We also have a fantastic website, Parkinson.org. It's a place where you can go to find accurate information. I think the internet can sort of be an unsafe place if you don't know where to look for information. So definitely check out Parkinson.org. Lots of information. You can order any of our free resources through the helpline or by visiting our website. So these are just some of the educational books that you can order. We have one on cognition and mood and managing PD mid-stride. Those are certainly, all relevant for today's presentation. So as Martha Ann mentioned, we also have virtual programs happening every single week, Mondays, Wednesdays, and Fridays. You can actually join us for a program just like this, Mindfulness Mondays, Wellness Wednesdays, Fitness Fridays. Visit parkinson.org/PD Health for more information and to register. So this is a fantastic resource. Again, this is free and available to patients, families, anybody looking for more information about Parkinson's and how to best live with it. So definitely check out PD Health at Home virtual programs. And again, these are some of the mental health resources that are available, most of them through the Parkinson's Foundation. our helpline. We even have a podcast. You know, if you have loved ones who are in the car a lot, podcasts are a great way to kind of get bits and pieces of really useful information. We have webinars like our expert briefings and PD health programs. We also have PD conversations. And bear with me one second. All right, sorry about that. But those are just some of the resources that we offer as an organization. So I encourage you to please check them out. Again, call our toll-free helpline, visit our website, parkinson.org, and please, you know, as always, stay safe and healthy, and let us know how we can best support you on this journey. But thank you so much to Martha Ann. Thank you to Jennifer Rakowski and the YMCA of Metro Atlanta. This has been a wonderful program today, and we hope that you've gotten a lot out of it and a lot of really useful information. So thank you so much, and stay safe.